So actually, my title of the talk is not a really big data challenge. It's really just about the computation. Then let me show you what kind of computational challenge we are facing. So first I'll introduce what is tissue deformation analysis. This is a pure engineering topic. And then in tissue deformation analysis, there's a common known problem in ultrasound-based image analysis called feature motion decorrelation. We proposed a couple of filtering methods, and it looks like the precision of the couple of filtering methods can be much higher than traditional method. I will show you why. But also, I actually like to emphasize that we are still facing the computational challenge. I actually kind of feel that we are out of tools to address this challenge. I actually realize that there are many people in math in the audience. Maybe you can help us. So-called tissue deformation analysis stems from this manual palpation. So when you see a doctor, normally the doctor will touch your body and try to feel whether something beneath your skin maybe is harder than the normal tissue. If that is the case, normally they will suspect maybe something, whether it's benign or malignant, maybe there's some tumors. This can be only done if that part is right beneath the skin. So deep inside the body, normally we use an imaging device to help us. And ultrasound is one of the widely used instruments to do this. So the idea of this is actually very clearly explained in this cartoon example. This is called elastography. So you use the transducer of the ultrasound imaging device to take one image before you press down the transducer. Then after you press down the transducer, you take another. How hard the tissue roughly is. So in this elastography imaging procedure, the basic requirement is that you have to have accurate estimation of the tissue displacement. But actually, this is not easy for ultrasound images. The reason is that when you look at the ultrasound images, they have many so-called speckles. It's a texture. This texture is a result of overlapping reflected waves with different phase. Normally, people assume that these speckles won't change before and after tissue deformation. But this assumption actually is flawed. It's not right. Before I show you why this assumption is flawed mathematically, I also show you another example. This is so-called echocardiography. It's an ultrasound imaging modality to look at the heart. So this is actually a very nice four-chamber view of the heart. And actually, we have volume images over time. So it's actually 3D plus time. When can this be used? This is often used in the emergency room. So when somebody says, okay, I have chest pain. Now actually chest pain is an alarming signal saying that somebody may have a heart attack. Then for that kind of patient, it's impossible to put him or her under the MRI machine for 45 minutes. That's too long. So then in the emergency room, the only device that is possible to make a quick assessment is actually this so-called echocardiography, ultrasound imaging modality. But from the appearance here, you cannot really tell whether some tissue are dead or not. The hope was actually if we have this kind of image, if we can derive the perfect spectral tracking algorithm, and then we will know the displacement field, again, just like before. Then we can derive the strain value, then we know the tissue hardness. And the dead tissue are harder, therefore we know where exactly the attack happened and to what extent the heart attack is. But again, we fall into the same fundamental assumption flaw, that is, the speckles are not motion invariant, they are actually motion variant. Then how to address this problem actually becomes fundamental in many applications. So how do we actually mathematically approach this problem? We normally use this so-called linear convolution model to describe the imaging process. So on the left in the cartoon here, we just mimic one unit of the ultrasound probe. Normally, we will have thousands of them. But here, suppose we have only one. It will send out a spherical wave, and the spherical wave will be reflected by the muscle unit in our tissue. Normally, we just mimic this process as a reflected spherical wave. And they have different position, different reflectance coefficient, and also different time, basically. Then when all these waves come back together to the transducer unit, the transducer now is turning into the receiving mode, and then the overlapping or the summation of this reflected wave will give us the image. And this process can be approximately expressed using the linear convolution model. And in the linear convolution model, the system function, or the so-called point spread function, is denoted with the Gaussian weighted cosine, or you can call it a double function. And the scatter are modeled as a set of derived functions. This is one component here. If you change the xn, then you will have a different location. If you change an, the reflectance will be different. So the radio frequency signal of the ultrasound imaging device, which we call the IF signal, will be the convolution between these two terms. And then this capital N is the number of muscle units in a resolution cell. So, and the commonly used signal in ultrasound is so-called B mode. B stands for brightness. So the B mode signal will be the analytical signal derived from this RF signal. So how do we derive the analytic signal from the RF signal? Basically, we change this cosine function into the complex harmonics. So, or in other words, we take the Hilbert transform of the original signal and make that as the imaginary part, and then add it back to the original IF signal part. And then the amplitude of this analytical signal will be the B mode signal. So this is a widely accepted linear convolution model used in ultrasound imaging. So now let's describe what is tissue deformation. We used a fine motion model to approximate the tissue motion or tissue deformation. So here, this matrix M is a 4x4 matrix. The D is the translational vector in 3D. And this R, the 3x3 submatrix, will denote rotation, scattering change, sharing, and all other components in the fine motion model. So this 0 here is actually really 0 components. So then overall, we will have 12 elements, unknown elements in this 4x4 matrix. And if we describe a tissue motion, then it will be the location of the scatter multiplied by this fine motion matrix M. So this is the analytical expression, equation 6. Then if we say that the image change is only caused by the tissue motion, then we should be able to compensate for this variation by changing the coordinate of the image, which is inversely multiply this M to this X, not the scatter anymore on the variable actually. So that will give us this equation 7. So when people make assumption about the tissue has no facial motion decorrelation, which means that the tissue will not change after motion, then equation 6 and 7 should be the same, should be identical. And in order for this to be identical, then actually the parts that I highlighted with this underbrace, they should be identical. And that actually will lead to this condition 8 and 9. So when we have translation, this condition is satisfied. When we have a rotation around the so-called axial direction, with the rotation, axial direction means the propagation direction of the wave, then this condition is satisfied. But if we have rotation along the lateral direction, which is parallel to the face of the transducer, or when we have deformation, meaning the compression and extension, this actually will not be valid anymore. And that's actually the fundamental flaw in the assumption when people use the spectral tracking concept. So before our approach, there are people who try to use so-called high frame rate imaging, especially the current one called the ultra-fast ultrasound imaging. They can actually get even 10,000 images within a second, two-dimensional. Certainly, if you sacrifice some resolution in two-dimensional, you can make three-dimensional images. But actually, even 200 Hertz has been available for many, many years before this ultra-fast ultrasound imaging is available. So the idea here is that let's make the deformation between neighboring frames very small, so small that your original assumption is still valid. So the limitation of this kind of approach is that if we try to study the heart, then we need a 3D imaging. And the heart actually has a phase of so-called acceleration. It's very quickly changing. That's the pressure that pumps the blood into our body without a problem. And then with the current frame rate up to, in the commercial product, we can get 20 to 28 volumes per second. The deformation between neighboring frames still will be too large for this kind of hardware-based method to handle. In other words, the fundamental assumption that the features is motion invariant is still not true. So then at the software level, there are many algorithms proposed. People use additional constraints like so-called tissue incompressibility constraint, saying that tissue is not is like a plastic rubber, so the total volume won't change. You can reduce the degree of freedom in the matrix by using this, or you use deformable mesh method or so-called finite element method. Actually, they're all published in the top journals in the field. And also the so-called multi-scale estimation method. You just think about the pyramid method. You do some coarse estimation first, then slowly or iteratively refine estimation results. So these methods are all based on approximate solution. So in other words, there's no analytical solution to the problem we mentioned. And then there are some concrete or explicit models that describe how images will change after tissue deformation. In 1D, they call it temporal stretching, or in 2D and 3D, they call it compounding. This compounding method is actually closest to our coupled fitting method. So the way they do this is that they really look at what kind of change will derive from the tissue deformation. And in the compounding method, they really just model this variation as a shift, the translation plus some scaling. And we notice that if you have a large deformation, the compounding method also fails. We actually started by trying to understand why they fail. So, and this is actually the idea behind the compounding method. Still, we have this linear convolution model, the scatterers convolving with the point spread function. Then after tissue deformation, then the xn, the location of the scatterer will change into yn. And then here is basically, this is the cartoon. We just show that the tissue before and after deformation, there was change from, if you think about it, this is a compression, there was change from a circle into an ellipsoid shape. So then the idea of compounding is actually trying to recover the original circle shape by modeling this rotation, the 3x3 matrix, and the translational vector. So we actually just did some deduction. Try to see what will happen if we replace the original xn with yn, and then it really, after a few steps, you get this. And then you will see that if you change the image accordingly, just using the same idea that we did before, but on the deformed scatter, then the linear convolution actually eventually will lead to the equation here. So it turns out that if you use image motion to describe this change, it is actually equivalent as saying that you will convolve the original tissue unit with a modified point spread function. So if this M is identity matrix, that will be the original image. But if M is not the identity matrix, then the image will change. And actually, when we got this, we were very excited because this exactly explains why the compounding method works when you have translation, when you have axial rotation, and even when you have small deformation, because this M is close enough to the identity matrix. But when M is too far away from the identity matrix, this actually is not the original image anymore. Then the assumption fails. So up to now, seems like everything is clearly explained, just we don't know yet what we can do. But then we realize that if we further convolve this, change the image with the original point spread function, then we convolve the modified, the original image with the modified point spread function, then actually we got an equal sign here. So then the remaining problem is just to find this M. If we can find an M that satisfies this equation, then the problem is solved. And the previous approximation method, you don't need them anymore because we have the exact solution. So, and actually, this is the basis for the compound, for our coupled filtering method. So then the remaining issue is how to find an N that can make this happen. So we did, so the algorithm itself is just a brute force search. So, and then we did a simulation. We checked the signal quality. The correlation coefficient should be 1 if the signal is perfectly matched. The compounding method, they will degrade, but our coupled filter method will not degrade. We check the rotation case. We also run studies on the front-end image. So this is a pair of front-end image. made of gel of different density, and then there's a channel here filled with water to mimic a blood vessel, and the dark tissue here, the stiffness is higher. It's made of different phantom. This information, the boundary information, we don't use it. We just try to showcase this clearly here, and then just see whether the motion estimation method can reveal this boundary clearly. If we have a 5% compression, so 5% of deformation, then the compounding method will give results like this. You can say it looks reasonable, but actually, if you check the correlation coefficient of the signal quality is only 0.65. But if you run our method, actually we got the correlation coefficient much higher, it's about 0.9, and the boundary is more clearly visible. And if we check the signal quality, it's really like only at the boundary where you have multiple media, then the original assumption will fail, because that's the time point you have two different kinds of motion. And the original brightness constraint only deals with one single motion. But overall, it looks very nice. So, okay, then it comes down to the challenging part. That A matrix has 12 parameters. Even we use the tissue incompressibility constraint, still we will have 11 parameters for 3D. For 2D, it can be simplified, but still we have 5 parameters. And actually, using brute force to solve this problem is very time consuming, because you have to surge with very small steps, and then the range is actually relatively large. We even try the multi-scale framework. We put in this tissue incompressibility constraint here, but the computational time, it's like 5 hours if we use a GPU. We got another student who tried to use the FPGA implementation, and we managed to bring this 5 hours down to 15 minutes. But this is only for 2-dimensional case. For 3-dimensional case, still we don't know what to do actually. But our goal is to make this into clinic. And in order for this to be used in clinic, in the emergency room setting, we really need that to be below 1 minute for 2D case. And maybe for 3D case, let's make it a little bit longer, say 10 minutes. Maybe with the more advanced hardware, this can be further reduced. But at least this is the goal we should achieve before we can say this is ready for clinical application. And it's like based on our experience, the hardware acceleration seems to lead to the dead end. We already tried FPGA, and that's actually already very good graphic card. Also, the settings, the FPGA card we're using a few years back actually is the most advanced one. So I think we still have to come back to the algorithm level and think about the new algorithms that can actually further accelerate the coupled filtering method. And actually, this is what I have today. So thank you.
Is there any question from the audience? Alrighty, let's thank the speaker.